Hi, and welcome back to Pills and Bills. I'm a practicing clinical pharmacist with a passion for teaching and an even bigger passion for paying off my crippling student debt. I did design this top 200 drugs coloring book by myself to help med, nursing, pharmacy students, and techs learn smarter. So grab a pencil, let's color, review, and make these drugs stick together. If you'd like to color along with me, this book is available on Amazon and TikTok Shop now. And with that, let's begin. Today, we're breaking down Vicodin, a combination of hydrocodone and acetaminophen that's commonly prescribed for short-term management of moderate to severe pain. Next, we have our PharmaLink phrase. This is a quick memory hook that your brain can latch onto to help you better remember the brand generic pair. Hydrocodone was first synthesized in the early 1900s using codeine and a chemical hydrogenation process. It was originally marketed as a safer alternative to other pain meds before we understood its full potential for addiction. Interestingly, the difference between hydrocodone and codeine is just a small change in a functional group that dramatically increases hydrocodone's potency at the mu opioid receptor. Vicodin is classified as an opioid. As mentioned, Vicodin is used to treat acute, moderate to severe pain, especially nociceptive pain. That's the type of pain that comes from a tissue injury like surgery, a dental procedure, fractures, or sprains. Moving to our mechanism, hydrocodone works by binding to mu opioid receptors, increasing the pain relief signaling pathways and decreasing the transmission of pain signals. As we reviewed in an earlier chapter, acetaminophen adds additional analgesia through central COX inhibition. Vicodin may cause dizziness. That happens because opioids depress parts of our nervous system that are involved in balance and blood pressure regulation, sometimes making patients feel lightheaded, especially when they stand up quickly. Constipation may occur because opioids slow down the movement of the gastrointestinal tract, reducing peristalsis and increasing fluid absorption into the intestines, which makes stools harder and more difficult to pass. Many opioids, including Vicodin, carry a box warning for addiction and misuse. Even if used as prescribed, repeated exposure can lead to tolerance, dependence, and if misused, opioid use disorder. Hydrocodone activates the brain's reward pathways, releasing dopamine that feels reinforcing and can sometimes drive misuse, dependence, and addiction over time. Our next warning is for life-threatening respiratory depression. Opioids suppress the brainstem's respiratory drive, meaning breathing can slow to a dangerous level. The risk is highest with large doses in opioid-naive patients or when combined with other sedatives like benzodiazepines or alcohol. And finally, accidental ingestion, particularly by children, can result in a fatal overdose. Even a single dose can contain enough opioid to cause respiratory arrest in someone who is opioid-naive or much smaller than the intended patient. Therefore, it's critical that these meds are stored safely and out of reach. And that completes our review. See you next time.